We're waiting for her now. Okay. Well, good afternoon, everyone, and thank you for being here. Well, there's no one here in the room. Just a quick note about our daily press conferences. In order to ensure that all of our leadership team has sufficient time each day to focus on the work they're doing at hand, we're going to start limiting these briefings to 1 hour. We're going to limit the number of speakers so that we can get to your questions sooner. But we ask for just one set of 3 questions per media outlet from a single reporter with that outlet. If time permits, we will go a second round. Today we bring truly difficult news: the first death of a Philadelphia resident to the coronavirus. Dr. Farley will speak more about this in a few minutes. We are all deeply saddened by the loss of this resident. Our prayers are with the family and loved ones at this very difficult time. Our administration has made fighting the spread of this disease a top priority, and we continue to take a proactive control steps recommended by the Health Department, the Pennsylvania Department of Health, and the Centers for Disease Control. The death of this resident is terrible for the family and friends, and is a reminder of the extremely serious nature of this pandemic. The unfortunate reality is that there will likely be more deaths as the number of cases grow, which is why our stay-at-home order is essential. This virus is very real and very deadly. And when we tell residents to stay at home, to avoid even small gatherings on the street corner, we are not kidding, we're serious. This is resulting in people dying. So I will repeat, stay at home. Because even if you are healthy, you could pass this virus on to a loved one who is not. And we don't want them or you to become the next fatality. And a couple of other notes. First, we have extended the closure of non-essential city government operations. The original closure expires this Sunday, so we have now extended that until April 6th, in line with the governor's most recent order. I know you have questions about how Philadelphia could be helped by the federal aid package that has now finally been agreed to in Congress. We're pleased with the passage, although having this a week ago certainly would have been more helpful. The direct payments to those earning less than $75,000 will provide an immediate boost to many Philadelphia households. The provision for emergency loans to small businesses that do not lay off workers is very important, and we hope that this plan can be accomplished quickly and with as little red tape as possible. We are particularly pleased with the provisions for worker protections and what appears to be a dramatic extension of unemployment benefits. I am told the maximum unemployment benefit is increased by $600 per week, and the bill ensures that laid-off workers, on average, will receive their full pay for 4 months. I hope this measure alone brings some comfort and hope to Philadelphians who have already lost their jobs or face the prospect of losing their jobs because of this virus. There's $100 billion for a new program to provide direct aid to healthcare institutions on the front line of this crisis, hospitals, public entities, and nonprofit organizations. Also benefiting with this provision are Medicare and Medicaid enrolled suppliers and institutional providers to cover costs related to the public health crisis. I am very pleased to see that some of this package includes direct aid to cities and counties. It's extremely important that these dollars get to cities as expeditiously as possible. I want to thank the Democratic leadership on Capitol Hill. This package is a significant improvement over what was originally proposed by Senator McConnell, primarily because of the direct aid to cities. There's a lot more in this package, and our team is still poring over the details. But at first glance, I can tell you this package is a significant step toward ensuring that all Americans, including Philadelphians, are able to weather the economic hardships of this pandemic. And now I ask Dr. Farley to give us our daily update.
Thank you, Mayor, and thank you all for joining. I want to give you the latest health update for Philadelphia. Since our briefing yesterday, we've had 93 cases of the COVID coronavirus reported in the city of Philadelphia, bringing our total now to 342 cases. Now, if you've been following closely, you may see that there's a little discrepancy between the number of new cases and how many cases we reported yesterday and our total today. What happens is I'm trying to give everyone the latest data we have, but as cases come in, they are sometimes reassigned to other counties, or cases initially reported to other counties are reassigned to Philadelphia. So our total may be a little different from adding up our new cases today to our total yesterday, but the total I'm giving you is the most accurate count we have right now. As you can see, this is an increase from yesterday, and overall this disease is increasing rapidly in Philadelphia. Here are details on the 342 persons who have been reported so far. 12 of them were under the age of 20. 163 were between the ages of 20 and 39. 85 were between the ages of 40 and 59. And 82 were over the age of 60. And of that group, 37 were known to be healthcare workers. As the mayor said, among these cases, we now have the first confirmed death from the COVID coronavirus in Philadelphia. Every death is a tragedy. We don't want to discuss this as just simply statistics. I don't have the details and will not give you the details of this specific person for the privacy and confidentiality of the person and the family members, but I can say this was a male in his 50s who had an underlying medical condition. This is the first death in Philadelphia, and as the mayor said, we certainly expect more deaths in the future. We can't save everyone. We want to save as many people as possible, which is why we're taking all these steps we can to try to slow the spread of this infection. Among them is testing people who may be at risk. Just an update on that. Most hospitals in the city have testing available. There are more than 20 sites in the city, but their testing is limited by the availability of test kits and by the availability of personal protective equipment for the staff who are working there. So these hospitals have established criteria for who they will test, and it's done by referral. So if you want to get tested at one of these sites, you have to contact a physician at one of these sites for that referral. In general, testing is appropriate for people who have symptoms of the coronavirus infection who are either healthcare workers or above the age of 50. If you go to our website, there is more detailed guidance about whether you should be tested, and if so, how you can get a test. One of the sites we have is Citizens Bank Park that the City of Philadelphia is working with federal and state partners to operate. Yesterday, that site tested 153 people. Today, because it's going to be raining all afternoon, and because the last time we tried it in the rain, it did not work out well, it'll be canceled. However, we will be in operation tomorrow from 1 to 6 p.m., and we hope every day from 1 to 6 p.m. Now, with the increasing number of positives that we are reporting today, we will have and will continue to have more positives of people who have been working. And so there'll be situations of someone who is in a workplace who now has a positive coronavirus test. Eventually, I would say most workplaces that are still in operation will have at least one employee who is positive. Now, most of those employees are probably exposed at home. That's what we find evidence from in other countries, that most people with this infection in general are exposed at home. But we'll never know for an individual case where that employee was exposed to this virus. If an employee tests positive, there is guidance at our website as to what can be done at the workplace to see what other employees may have been exposed and to take steps to try to prevent transmission to those other employees and transmission to other employees who were exposed to those employees. In general, if an employee or another person was in contact with the person who had a positive test for more than 10 minutes at a distance of 6 feet or less, then they would be considered a medium or high risk person who should quarantine for 14 days after their last exposure. People who have less exposure than that should simply monitor for symptoms and be very quick to avoid the workplace or contact with other people if they have symptoms. Environmental cleaning needs to be done, but it's basic environmental cleaning. There's no special procedures that need to be taken under that circumstance. Now, the City of Philadelphia has many employees, and so we expect that there will be cases in city employees, and indeed we have had now cases in city employees. We now have had at least one case among civilian city employees, among members of the police force, and members of the fire department. And the city will follow its own guidance in working with employees that may have been exposed to those employees to protect their health and to prevent transmission to other people who work for the city. Let me just remind everybody again, we can't say it often enough, what everyone ought to do to stay safe. If you are not essential at work, if you're not required to be at work, stay home. If you must go out, for example, you have to work, then keep your distance from other people and wash your hands. And then, most important, I have to say as many times as we can, if you're sick with fever or respiratory symptoms, it's particularly important to stay home. You don't want to spread this infection to others. Now, last night, the task force at the federal level that's overseeing the COVID response made a recommendation that people who were in New York City and they traveled to other places go into quarantine on their own for 14 days. We think that this advice makes sense. New York City is seeing a very rapid increase in cases, more than 2,500 cases per day in the city alone. As the city that is the closest to New York City, amongst the cities in this nation, we want to limit as much as possible the spread of infection among people who have traveled between the two places. And there are many people who do travel between the two places. So the city will be posting today recommendations that if you have traveled to the metropolitan New York City area in the previous 14 days, in the last 14 days, to go on your own into quarantine for 14 days. What do we mean by quarantine for 14 days? It means because we're all, in a sense, in semi-quarantine, it means that you be particularly careful and vigilant, that you stay inside for that 14-day period. Have someone deliver food to you, someone deliver whatever else you need. You stay inside so you're not in contact with anyone else, including, if at all possible, including your family members. When I say the metropolitan New York City area, the counties that we're talking about are the 5 boroughs of New York City, plus Nassau County, Suffolk County, and Westchester County in New York State, and Bergen County in New York City. So if you have lived in those counties, or if you've even traveled in those counties in the last 14 days, and you're now in the Philadelphia area, we request and recommend that you go into quarantine for 14 days since the last time you were there. In general, if you want to help with the city with this response, you can look into our Medical Reserve Corps. We have an interest in doctors and nurses and also people who are not clinically trained to help in a variety of roles. Go to www.phila.gov/MRC for Medical Reserve Corps. I was asked yesterday how many people have signed up, and since the emergency began, we have more than 900 volunteers who have registered, which we think is wonderful. We are putting those volunteers to good use, so if you want to help out, go to that website and register. If you want more information about this, the city's response to the crisis, www.phila.gov/COVID-19, or even just COVID or COVID-19. All 3 of them should go to the same site. And if you have medical questions, 1-800-722-7112. Thanks very much. And I'm going to turn now to Joanna Otero Cruz, who will give you this information in Spanish.
Muy buenas tardes, mi nombre es Joana Otero Cruz, la subdirectora de Servicios Comunitarios aquí en la ciudad de Filadelfia. Voy a compartir la actualización de materia de salud hoy día 25 de mayo 2020. Una información sobre COVID-19 en Filadelfia. Desde ayer a la 1 de la tarde se han confirmado 93 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 342 casos confirmados. La tendencia es que los casos sigan aumentando rápidamente. Los detalles que podemos compartir sobre los casos son los siguientes: 12 personas menores de 20 años, 163 personas entre las edades de 20 a 39 años, 85 personas entre 40 y 59 años, 82 personas mayores de 60 años. 37 son trabajadores de salud. Lamentablemente confirmamos la primera muerte en Filadelfia por el COVID-19. Un hombre de 50 años con condiciones previas. Sobre las pruebas están disponibles en la mayoría de los hospitales con las limitaciones en la cantidad de kits, pruebas y capacidad de los laboratorios. Debemos recordar que la mayoría de las pruebas son para personas que presentan síntomas, son trabajadores de salud o tienen más de 50 años. Hemos publicado orientación sobre quién debe realizar pruebas de coronavirus en el sitio web COVID de la ciudad. Sobre el centro de las pruebas en el Citizens Bank Park, ayer se realizó 153 pruebas, pero cerramos temprano debido al clima. Hoy estará cerrado por la clima. Mañana estará abierto de 1 a 6 de la tarde. Los casos aumentarán. La tendencia es que encontrarán más casos positivos en el lugar de trabajo. Eventualmente, la mayoría de los lugares de trabajo experimentan en esta situación. Si un empleado está diagnosticado positivo, el protocolo es el siguiente. La persona enferma debe permanecer en cuarentena. Colegas que hayan estado expuestos directamente a la persona a menos de 6 pies de distancia o por un tiempo prolongado deben estar en cuarentena. Colegas con menos exposición deben monitorear sus síntomas. Debe realizar una limpieza profunda del lugar de trabajo. La ciudad tiene empleados que han sido diagnosticados positivos, incluyen civiles, policía y bomberos. La ciudad estará asegurando y siguiendo la misma protocolo previo. Haremos todo lo posible por cuidar a nuestra gente, pero necesitamos su ayuda. Si no es indispensable para su trabajo, quédese en su casa. Si debes salir porque tienes que trabajar, sigas estas medidas. Mantenga la distancia social, lávese las manos. Si está enfermo, quédese en su casa. Los casos en Nueva York estarán incrementándose rápidamente. Recomendaciones se han llevado a Nueva York. Son los siguientes. Si usted recientemente ha visitado a Nueva York, los 5 condados de Nueva York, y Nassau, Suffolk, Westchester, el estado de Nueva York y Bergen en Nueva Jersey, deben estar semi-cuarentena por 14 días. Quédese en su casa. Si es absolutamente necesario salir, use una mascarilla. Si quieres ayudar, necesitamos voluntarios. Ingrese al sitio web www.phila.gov/mrc. Tenemos ahora 900 nuevos voluntarios. No olviden consultar el sitio de web para mayor información, phila.gov/COVID. O también pueden visitar al COVID-19. Recuerde que puede llamar al 311 si tienes preguntas sobre el COVID-19. Tenemos servicios de traducción en 100 diferentes idiomas. Respuestas y preguntas médicas las 24 horas, los 7 días a la semana. Pueden llamar al 1-800-722-7112.
We're happy to answer any questions now for people regarding medical issues in English or Spanish.
Okay, thank you. We are going to now take questions. As we have reiterated, we will unmute your microphone when it's time for Q&A. If you want to use the raise your hand function, which is under participants, please press that and you'll be added to the queue. We do have a limited time, so please limit your questions to the 1 to 3 of most important. Thank you. first, we're going to Sean Walsh at the Inquirer.
Hi, thanks very much. I was wondering if there was someone there who could update us on the negotiations over Hahnemann Hospital, and in particular, what would it cost for the city to get a ready patients?
I see a name on the screen here, but I don't hear any audio. So if you're asking a question, we can't hear it. Sorry, we're going to try to work that out.
All right, still can't hear me? Sorry about that, are you still unable to hear me? We're good?
Yeah, Sean, we can't hear you.
Can you guys
Hold on,
try
can I type?
pressing, making sure the audio cable is in on the left and right-hand side of the...
Should we go on with other
Yeah.
talking
Kelly,
points
can
and
you move on?
come back?
Sean, just one sec, we'll move on. I'll hold you, please. Claudia Lauer, the AP. Hey, can you hear me? Hi. Hi, Claudia, I can hear you. If you want to just
Kelly,
say your question and I'll answer it.
Sure, of course.
can you unmute reception
I
room?
wanted to clarify from Dr. Farley, he had said at least one employee, and he listed civilian employees, police and fire. Is that one in each department, or is that one alone?
Dr. Farley, Claudia is asking you listed civilian employees, police and fire. Is that one in each department or is there more in each of those groups? It looks like that they
Hey, Cody,
can't hear
can you come
us.
take a look? They can hear us.
Oh, they can hear us? Could you try speaking, please?
Sorry about just if you could just hold for a second, we're just having some audio issues. We're working on it right now.
Kelly, we can hear you.
Yeah,
We can hear you now.
Okay, can you guys hear me at the podium?
Yes.
Okay, great, great, great. Sorry about that, everyone. Let me just let's go back to Claudia. Claudia, could you ask your question again? Sorry about that.
Sure. I mean, Sean was in front of me. Did you want to start with Sean? I don't want to step on his toes.
Gotcha. I'll go back to Sean. Sean,
All
can
good.
you ask your question? Thank you.
Sure, you can hear me now?
Yes.
I got a nod from Dr. Farley, so okay. I don't think I could hear him though. But okay, I wanted to ask for an update on the Hahnemann negotiations. How is that going? What's the status of that? Councilwoman Gim has suggested using eminent domain to get the property. And then also related to that, what would it cost to, revamp the facility to be able to take patients?
So I think there's several things
So
there.
I can't hear Brian. I don't know if anybody
Can you
else.
hear?
Brian, can you hold on one second? We cannot hear you. Can you press unmute on your laptop there?
There. Sean,
Okay,
Sean,
great.
can you hear us now?
Now I can, yes. thank you.
Excellent. So that question has several layers there. So we have presented a counteroffer to Hahnemann and to Mr. Friedman. Given the condition of the building and given the current needs, we're certainly willing to cover the owner's operating expenses, but don't feel that we should be paying rent for what would otherwise be a vacant building, especially given the urgent and critical needs that the city is facing. We have not heard back from Mr. Friedman on his posture based on that negotiation, and again, we are certainly willing to negotiate. I think on the question of eminent domain, we are certainly looking at all of our legal options at this point. Eminent domain specifically does require us to pay fair market value for the property, but we are working with the law department on multiple fronts to see if there are other options. And I also want to make it clear what Hahnemann could be used for. We don't expect Hahnemann to be open as a medical facility. Again, it is a completely empty building. It does need significant repairs to several of its systems like HVAC and elevators to be certified and operating again. But we do think it could be useful for either isolation space or quarantine space or potentially a receiving area for hospitals as patients get well enough to leave hospitals. So there's a few things on the table, but I don't want to imply that this is going to be an open and operating hospital again, because I don't think that is likely. And I think we've been fairly consistent about that, but I know there's still confusion.
Thanks. And for sanitation workers, how many of them are showing up to work? Is it affecting service? And do they have enough protective gear for them? And have there been complaints from the workers, like, concerns about their own health?
We haven't seen the issues that Pittsburgh has seen. We have not seen a high absenteeism, and we're in consistent communication with our union leadership and have provided additional protocols for our sanitation workers, so we haven't seen any impact on service.
Lastly, have the cases been clustered in, or have many of the cases been clustered in one area of the city? Is there like a localized outbreak in one neighborhood that's higher than other places?
Yeah, at this point, I can only tell you we've had cases in every area of the city. In the future, I hope we can present a map to give you a sense for the different numbers of cases in different areas of the city, but certainly the entire city has cases now.
Thank you.
Okay, back to Claudia Lauer at the AP.
Hey, thank you for taking our questions. So I had a clarification for Dr. Farley. When you had said that at least one employee had tested positive in the city, you then listed a couple of different departments. You said, civilian, police, and fire. Was that one employee in at least each department?
Yes, and that means at least one police officer, at least one firefighter, and at least one civilian employee.
Okay, thank you for that clarification. And then secondarily, I was looking for some information about whether or not there have been any issues in the city's prisons department, if anyone had tested positive, a jail guard or any of the prisoners.
At this point, we've had no positive tests from either inmates or from correctional officers.
Thank you.
Okay, next we're going to Jeff Cole with Fox 29.
Yeah, good afternoon. A question for the mayor. Mayor, it looks like under this $2 trillion deal that there's $150 billion in direct aid to state and local government. Do you have any idea at this point how that money will be cut up to a city the size of Philadelphia? And based on what you get, where do you initially direct it?
Well, we do not have a specific lineup as to where the money's going. We have a team of people in finance and revenue and other departments that are working on making sure that the money winds down to us as quickly as possible. And then we'll sit with all the departments and the managing director and chief of staff and figure out where we need to supplement, where we spent the most money, what the money that we get is eligible for, and that's all to be worked out. But we're, again, pleased that the Congress has come to an agreement, at least on getting aid directly to cities and counties as opposed to going through the states. But we will have more information as we see how much we get and where we go with it.
One other question for Dr. Farley. Dr. Farley, the governor of New York has been very loud about the limited number of ventilators, what he needs, as opposed to what he's been able to get from the federal government. Have you gotten any new PPE shipments or medical equipment, including ventilators, that you know of from the federal government or any private entity that's looking to help?
Well, first of all, New York State and New York City is the epicenter of this crisis across the country. They're hit particularly hard. We're doing everything we can to avoid having us be hit as hard as they are. We are tracking how many ventilators we have here, personal protective equipment we have here. I'm not aware of us getting federal shipments of either of those, but I know that we have requests for both of those, and we'll track that over time.
Thank you.
So Jeff, I do want to clarify. So some of our health systems did receive a shipment from FEMA through PEMA, but it was not a significantly large shipment of PPE, and frankly, I'm not even sure what was contained within the shipment, but I did just want to clarify and give FEMA a little bit of credit.
Thank you.
Next, we have Jack Tomsick with Metro.
This question's for the mayor. Do you think it's likely schools will close for the rest of the year? And what are your thoughts on the district's plan to distribute laptops or other electronic resources to students?
Again, we don't know whether or not the school will resume this year. We take it day by day, hour by hour. I think the school district has done a good job in helping to or distributing food, and they'll do an equally good job in the distribution of the Chromebooks that they already have and the ones they will acquire. I don't know whether or not we're going to open again, but we don't want to close off the possibility that we can. And again, it's hard. A lot of these questions that we've been getting since the beginning of this is projecting forward. Projecting forward each couple hours is difficult, let alone projecting forward over months. But we're going to do, the one thing I can assure you, we will follow the medical advice as to when we can and cannot do certain things. Open schools, open government, get back to normal. It'll be a medical decision solely.
And this question's for Dr. Farley. We've had some readers call in and ask if it's safe to pick up our newspapers. So I was wondering if you could speak to the safety of that and maybe other commercial products, boxes, things in stores, whether the virus can, be on those things and whether people should pick them up.
Yeah, I'm aware of a study where they were able to, find DNA from the virus on surfaces after some period of time. But that doesn't mean that that virus is actually alive enough to infect a person. The best judgment we have on this from the Centers for Disease Control is that this virus degrades pretty quickly over time while on surfaces, and that the vast majority of the infection occurs through contact between two people. And so I would not, with that in mind, I would not think that there would be any risk to picking up newspapers or picking up boxes that are being passed around.
Right, thank you.
Next up is Nigel Thompson with Aldea.
Hi, I think this question is for Dr. Farley. My question is regarding the MRC. In terms of things that people can sign up for, obviously you ran through yesterday some of the things people are doing in those positions. Is one of them potentially translation, like on the ground translation services? I know the city is doing its work with translating stuff, but can you just talk to that if possible?
There are all sorts of roles that the Medical Reserve Corps could be involved in. Right now they're working at Citizens Bank Park, both in the collection of samples and also recording information. And so we haven't had a request for translators, but if there were translators, we would be was there a need for translators, we would be happy to receive that request and see if there are people who have registered for the MRC that could do it.
Cool. Thank you.
Next, we have Lawrence McGlynn with Philadelphia Neighborhoods.
Thank you. How long do you intend to use the Center City Holiday Inn as a quarantine facility? And do you have a similar plan for the homeless population in Kensington?
So the quarantine facility and the Holiday Inn is not just for homeless individuals. It's for anyone who can't quarantine at home. So I just want to make that clear. And as I said yesterday, we are pursuing multiple options regarding additional properties for quarantine and isolation space, which Hahnemann may be one of those spaces as well. As far as length of time, I think it will all depend upon what is the need and how long this crisis lasts. So I don't have a time period today.
Thank you.
Next, we have Charlene Santiago with Univision.
Hi, can you hear me?
Yes.
Yes, so are we able to make questions in Spanish now then, I'm guessing?
Sí.
Sí,
Okay,
dígame.
perfecto.
Buenas, Charlene.
Muchísimas gracias. Tengo dos preguntas, una específicamente en sala de emergencia. ¿Cuál es el protocolo que está vigente con relación a los doctores, enfermeros? O sea, ¿qué le garantiza a la ciudad a nuestros televidentes de que si van a sala de emergencia hay un protocolo establecido de seguridad y salud para estos proveedores. Esa es mi primera pregunta.
Gracias. This question is for Dr. Farley. Question specifically around what is the protocol for emergency rooms, health physicians, nurses and technicians that are there, and what kind of security measures are we taking both for them and the public that may come in still to emergency rooms?
Currently, emergency rooms have a relatively low volume.
Ahora mismo, el volumen que tenemos de personas visitando a la emergencia, las salas de emergencia, es bajito.
And the workers there are practicing using personal protective equipment to avoid them getting infected or passing infection on to patients.
Y las personas que están trabajando ahí siguen la protocolo para protegerse, usando mascarillas y cosas personales para que se pueda proteger a ellos, pero también a los clientes.
And in the future, if we get many more patients coming to emergency departments, they're working on protocols for how to process them quickly and deal with that increased volume.
Y para el futuro se está evaluando diferentes protocolos, si una cantidad de personas vienen a salones de emergencia, cómo se pueden procesar diferente y rápidamente.
Perfecto, y mi segunda pregunta es con relación específicamente al equipo de protección tanto para los enfermeros como para los doctores, porque actualmente en la página de la ciudad se están pidiendo donaciones. ¿Cuál es la situación actual con estos productos?
Her question is also for you again. What is currently right now the status of the protective gear for the health physicians in emergency rooms and medical personnel? Because right now our webpage is asking for donations.
We know overall in the city of Philadelphia that we have a shortage of personal protective equipment. So we have instituted recommendations for steps that hospitals can take to conserve the ones that they have.
Actualmente sabemos que la cantidad de equipo personal de seguridad para las personas que trabajan en salones de emergencia y clínicas es bajo. Así es que lo que estamos haciendo es proveyendo recomendaciones que los hospitales pueden ser para asegurar que tenemos ese equipo para el futuro.
And we are continuing to try to obtain more personal protective equipment for the future so that we don't have more severe shortages. And that's what the website request is about.
O sea que lo que está en la web y la orden de poder recibir donaciones es no si actualmente para ahora, pero para el futuro, porque queremos garantizar que cuando se necesite el equipo en el futuro tenemos una cantidad significante para proveer a estos proveedores de salud.
Perfecto, gracias.
Okay, next up is Pat Loeb with KYW.
Hi, I was looking for more specific numbers about the police and firefighters who have tested positive.
Thanks, Pat. We're not going to provide specific numbers.
Just at least one. Okay. And understanding privacy concerns, can you give us a little more information about when this first victim died, how long he'd been hospitalized, where he was hospitalized?
I can just tell you that the patient became sick a few days ago, was hospitalized briefly, and died in the last couple of days.
Thank you.
Next, we have Wendy Saltzman with NBC 10.
So you just made mention that the person was hospitalized briefly. So when people have the COVID virus, should they be hospitalized immediately, or what is the process people should be going through?
Now, most people with this infection have mild or moderate infection and can get it over it on their own, and they don't necessarily need medical care at all. But some people are at higher risk, so the elderly or people with underlying medical conditions. This person who died did have underlying medical conditions. We have recommended testing for people over the age of 50 with the idea that the older people are, the greater risk they are. So, and we've instructed anybody at any age, if they have difficulty breathing or shortness of breath, then they need to seek medical attention.
And what kind of therapies are being used in these hospitals? We've seen that there are, medications for lupus or other things that are being tried out, but is that even happening in Philadelphia as of yet?
Yeah, we don't have detailed information on the different therapies that they're trying. Most of the care, and what's most important, is supportive. That is to say, if people's lungs aren't working very well, they give them oxygen. If they need fluids, they give them fluids, but there's no specific drug to kill the virus that they can use right now.
With the individual who died then, did they leave the hospital and die when they were outside of the hospital atmosphere?
No, this individual went to the hospital and died in the hospital.
And then in terms of the number of hospital beds, how are we doing? You said we have 342 cases. I assume not all of those are in the hospital. So how are we doing in terms of hospital beds?
Right now, we have more empty hospital beds in the area than we do under ordinary circumstances by quite a bit, because the hospitals have canceled elective surgeries and other patients that don't need to be in the hospital, they've cleared out so that they can prepare for the surge. So right now, there are plenty of hospital beds. Of course, just to be clear, that could change, and we are trying very hard to make it so that we always do have hospital beds. And we're taking every step possible for that surge that we expect to happen in the future.
Thank you.
Okay, next we have the WPBI desk. 6ABC. You're now unmuted. Okay, we will come back to you. Next, we're going to go to Denise Clay.
Hello. I'm sorry. No, I do not have the coronavirus. I wanted to ask the mayor, since you were, did Dwight Evans, our representative, the city's representative in Philadelphia, in Congress, talk to you about the negotiations as they were going on, and what specific things were you able to, get from him as to what the city could expect from this bill?
Congressman Evans has always been available to us. I haven't had recent conversations with him. I know they're quite busy in the negotiations. He has always been there to support the city's needs, and I'm sure had a great hand in what the ultimate result was or is going to be. And I have an open door to Dwight Evans, and he has an open door to me. We just haven't had any conversation recently, but we've talked in the recent past about other issues outside the coronavirus. So he's a great representative and a great congressman, and we're happy he's there.
I think you can.
Now, what do you think, if anything, this might have in terms of an impact on the city budget? Now that you have to make some appropriations for the virus, and we still don't know what the virus is actually going to do in the city because it hasn't peaked yet.
Correct. So that's why it's impossible for me to give you the impact on our budget, because we don't know how many cases we're going to have. We don't know how much we're going to have to expend from the city treasury to supplement hospital beds, other issues that need to be addressed. So as we get closer to the bending of the curve and closer to decreasing cases, things will become more apparent as to how much we've totally spent and where we have to adjust our budget, and that'll be through the budget process when this is over.
Okay, also, the bill has a certain amount of money that it's giving to individual people who I guess are employed by someone, but you have a lot of freelancers in Philadelphia. Has the city thought about what it's going to do for those people? Because for a lot of us, not being able to utilize the gig economy the way we have been has been kind of hard. So has the city thought about what it's going to do for its freelance population?
I don't understand what freelance is. Are you employed?
I think I have it now.
We're self-employed for the most part.
All right, well, if there's issues relative to the lack of pay, I assume that you're covered under unemployment compensation, and you should research with the state site what you're eligible for, because and I don't know what the process is with the checks coming from Washington. We'll see as they roll out. But if you're experiencing unemployment or reduction in income, check out the state website on unemployment and file for what you're eligible for. But there's no specific city funded plan for freelancers.
Okay, and for Commissioner Farley, Around the country, you have people who are quilters and other textile artisans that have been volunteering to make masks for people who are, for healthcare workers that are working to fight this virus. Have you heard of any of those kinds of efforts in the city?
I understand on social media there are people talking about making masks. And so we have posted guidance on our website about if you're going to do this, how to do it in ways that might be protective. And so people should, with an interest in that, should just go to that guidance.
Rough draft.
Okay.
Thank you, Denise. Next, we're going to Jake Bloomgard.
Hi there. So a couple of quick questions. One, did you, there's somebody who tested positive in a nursing home a couple of days ago. Have any of the staff or the other residents in that facility tested positive since then?
I'm sorry, what was the question exactly again? Have the others tested positive? We have had additional positive tests from that nursing home, correct.
Among residents or staff or both?
Among residents. I can't give you exact numbers, and we're working with that nursing home and monitoring those residents closely.
Okay. I've been talking with some union leaders who have said that they're kind of like working on getting various types of construction projects kind of exempted from the overall ban moving forward. In particular, things that they think, could, help with this virus in terms of medical facilities, things like that. I was wondering if there are any particular kinds of projects the city could comment on that might be exempted moving forward.
I think the order that we issued earlier this week was clear that essential infrastructure, which would certainly include hospitals and medical facilities, pharmaceutical distribution, things like that, were considered essential. For things outside of that, I think the waiver process is fairly clear with the governor's office, and we'll certainly follow the state's lead on those issues.
And is there any, are there any partnerships underway in terms of local manufacturing for mask production or anything like that?
We are about to begin a partnership for mass production. I can certainly get back to you with details. I'm not sure if we launch today or we'll launch tomorrow, but we are. The local manufacturing community has been great to work with.
Okay, great. Thank you.
Okay, next is Brian Mendoza with NBC 10 Telemundo.
Buenas tardes, Brian.
Hola, buenas tardes, Johanna. Quería saber una actualización entre la negociación del Hospital Hahnemann con la ciudad para saber si se sabe cuánto costaría o cuál sería el servicio esencial que va a proveer este establecimiento si es que se hace ese contrato.
This question is for Brian regarding Hahnemann, the total cost and specific what are the essential services that are going to be provided at Hahnemann if we're able to execute.
We are still in negotiations with the landlord on costs.
Estamos todavía negociando el total de costo con el dueño del hogar.
To fit out the space will be several $100,000.
Probablemente para arreglarlo, para poder utilizarlo, puede costar más de $100,000.
And services could include quarantine space, isolation space, or mild or more minimal medical space.
Los servicios pueden incluir hogares para cuarentena y para aislar personas que tal vez no tengan su propio hogar, y puede incluir también cuidado médico bien leve.
Ok, muchas gracias. Y en cuanto Organizaciones proinmigrantes han pedido que liberen a indocumentados que están detenidos en estos centros de detención de ICE. ¿La ciudad está dispuesta a recibir a estas personas? Tal vez es una pregunta para el alcalde.
This is a question for the mayor. Many nonprofit organizations that work with immigrant communities have major concerns about individuals who are being detained in certain detention centers. Will Philadelphia be welcoming or able to receive individuals be relocated to Philadelphia?
Philadelphia was and is a welcoming city, and if people are released and come into our community, we'll welcome them with open arms.
El alcalde dice que la ciudad de Filadelfia es y si va a seguir siendo de dar la bienvenida a todo el mundo, y si las personas que están detenidas son libres y pueden llegar a Filadelfia, nosotros vamos a seguir recibiéndonos.
Ok, y otra pregunta más. Ayer el alcalde dijo que no hay un plan de ayuda económica para inmigrantes indocumentados que han perdido su trabajo y no pueden tal vez pedir ayuda por desempleo al gobierno, pero con este nuevo plan de ayuda aprobado por el gobierno, ¿se está hablando ahora tal vez de alguna posible ayuda para este grupo de personas, para nuestra comunidad indocumentada?
So again, Mayor, this is your question regarding many individuals who aren't immigrants and undocumented and don't qualify necessarily for unemployment. Do you see these additional benefits coming in or being provided from the federal government or locally accessible to the immigrant community?
Considering this administration in Washington and rules on unemployment, I doubt that undocumented folks will be eligible to file for unemployment. But I do know that through some of the funds that philanthropic funds we've been trying to accumulate, will be funding organizations that help take care of various sectors of our communities. And I believe that immigrants are also part of that. But direct aid without documentation is very difficult from a federal level.
Desafortunadamente, a nivel federal, el dinero que está dispuesto, aunque no sabemos todos los detalles, podemos hacer el estimado que no va a ser probablemente realizado para las personas que son inmigrantes sin documentos. Pero aquí en Filadelfia, a través de los recursos que se está desarrollando a través de las dos fundaciones filantrópicas, aquí a nivel local, sí queremos incluir personas que tal vez no tengan documentos para poder obtener diferentes recursos y apoyo.
Muchas gracias.
Okay, next we are going back to 6ABC. We have someone on the line.
Hi, this is Dan with WPBI. Yeah, my question is specific to the exposures regarding the fire department. We understand that Engine 53, it is a confirmed case with a young firefighter from that engine, and we're getting calls about what you guys are doing for self-quarantining and the number of self-quarantined employees from both the fire and police department as a result of exposure.
So we are not, again, not confirming where people are located, where they're deployed, or how many cases within our departments. But certainly anyone who has been exposed to someone who has tested positive, has been and will be expected to be quarantined under the health department guidelines at home.
But you're not going to release numbers of firefighters that are self-quarantined as a result of exposure to this employee?
No, I will say that sick leave in both fire, police, and prisons is not high at this point. But we're not going to list the number of people who are self-quarantining.
Also, we've gotten a number of calls, people asking why even mess around with the Hahnemann facility when you could just use the convention center like New York is using theirs and Atlantic City is using theirs.
So again, the Hahnemann facility is not for surge medical capacity. The Hahnemann facility, it would be for quarantine and isolation space. We are in conversation with other facilities for surge medical capacity. Convention center could be one site, but there are a number of other sites across the city that we are talking to as well. Again, Hahnemann is just one property of several that we are pursuing.
Okay, thank you.
Okay, our last question is from Max Marin at Billy Penn.
Hi, thank you everybody. I'll keep it short so we can get on with our days. Just one question for Dr. Farley.
Consistently, people under 40 have made up about half the cases in the city. And I know that this tracks with what we've seen in other nations with the spread of the virus, but can you tell me anything specific about the trends of the younger people who are getting diagnosed, sort of what their social activities have been, or what like level of precaution they've been taking, or just anything at all about those numbers that make up about half the cases?
No, we do case investigations to the extent we can on all of our cases, but we don't compile that kind of information. That information we compile is more about basic demographics. So I can simply say that the first wave of this epidemic is younger adults, because these are the people who are more likely to travel to places like Europe, which has been the hottest spot in the past. But over time, probably the demographics of the people with the infection will change.
All right, thank you for your time.
Okay, that concludes our questions. Thank you.
Thank you.